That's not a boy with asthma problems, is it?
He is always the first one off and into the door before his brother is.
We really didn't do preventative visits for their asthma. We didn't do maintenance visits when they were doing well. We would see them when they were having a problem and try to address the problem. And part of the new system is that we see them preventatively. We see them when they're well to make sure that their asthma is well controlled and that they're aware of their triggers. And the goal is to keep them out of the emergency room, to keep them out of the hospital, and to keep them out of urgent care centers, and to provide most of the care here at their medical home.
Since June of 2011, this child has not been in the emergency room for asthma.
So there's a lot of communication there. It's just not a one-sided thing. I tell her what's going on, and then she relays it to Scott. So we've all pulled together to help him and to put me a little bit more at ease.
I really feel like nothing's missing anymore. In the past, you didn't really know what was going on at home. You didn't really have contact frequently enough to know how they were really doing.
There was something telephonically that I couldn't get, and I thought if we could coordinate with other members of healthcare team and resources within the community, perhaps we can kind of envelop the child, mom, all the support systems, just like a great big hug.
Like, for example, with Sheila's family, suspected maybe there were some things in the environment, but they, or the nurse, Cindy Wibberley, couldn't go into the home and actually lay eyes on.
Working in the home environment, there's nothing that replaces that. I mean, you get a chance to investigate the environment with the family, and you find out things that even the family didn't realize might have been going on that impact that child's health and the health of the other people in the family.
Yeah, now that I know what his triggers are, we try to stay away from them. Still working on certain things that do trigger him. Still working on them. But now that I know what to do when he is in trouble, we up his Pulmicor, we do the breathing treatments every 4 hours. If I don't feel that I can get him under control, I call the doctor's office.
I mean, it's incredibly satisfying. It's in the first 5 years when I was here, it certainly was satisfying, but you still felt like there's something missing. I can't do it all. There's something else I'd like to be doing for this family, but I can't. There's not enough people, there's not enough money, there's not enough time, and I feel like those things are being addressed now. So we have the people, there are grants for funding, there's time, and less emphasis on volume and more emphasis on quality. And it just feels a lot better to be a physician now, and I've only been doing it for 12 years.